अस्सलाम वालेकुम डियर व्यूवर्स, उम्मीद है आप सब खैरियत से होंगे। आज हमारा जो प्रेजेंटेशन लेक्चर है वो दैट इज़ रिलेटेड टू फोरेंसिक फार्मेसी। सो व्हाट इज़ फोरेंसिक फार्मेसी? सो इन सिंपल वर्ड्स, फोरेंसिक फार्मेसी can be defined as the application of pharmaceutical knowledge to the investigation of crime, particularly in establishing the cause of injury or death. Forensic pharmacy is the branch of pharmacy by which we can apply the tools of the pharmaceutical knowledge. So with the support of pharmaceutical knowledge, we can find out or we can investigate a particular crime, and this crime is related to injury or this crime is related to death. So in this branch of pharmacy, how you will find out the cause of the death or injury. So by taking the support of pharmaceutical knowledge, you can easily investigate any particular crimes or which may be the cause of injury or death. Moreover, poisons can be defined as all the substances are poisons. There are no such things as non-poisonous. And in other words, poison is any substance which, when introduced into the body or brought into the contact of any part of the body, so it will produce ill effect or death by its local and systemic effect or both. So if you remember, in our previous lecture we have already discussed that if medicine they are taken in a large quantity, so it become poison, while if the poison, if it is taken in a small quantity, so it become medicine. What does it mean? So I mean that when poison come in the hand of a professional person, so pharmacist, he is the only person who can identify, who can investigate the root of the poisonous substance. So whenever certain substances come in contact with your body, so it will must produce some negative effects, or it may produce obnoxious effects or unwanted effect. So that effect may be local or it may be systemic. You know, there are different types of poisons. One is corrosive. Types of poison. Corrosive mean they are usually organic acid, inorganic acid, mineral acid, alkali, etc., citric acid, lactic acid, oxalic acid, and formic acids. So all these are corrosive in action. Let's suppose if it come in contact with your skin, so it will cause corrosive action on your skin, like citric acid, hydrochloric acid, phosphoric acid, sulfuric acid, hydrofluoric acid, sodium. So all these are present in a very concentrated form. If we put a small quantity of sodium hydrochloride on your skin, so it will cause corrosions, it will cause disruption of your skin. So it means these are toxic substances. It may be like potassium hydroxide, calcium hydroxide, etc. So it come under the category of poison. One is irritant. Irritants, it may be organic, inorganic, and mechanical irritants. Irritants can be found in the plant origin like Dathora stramonium, like Vitex and asparagus, while in animal source you can find out The irritants are like spider, like scorpion, toad and jellyfish. When we come toward the mechanical irritant, so it become metal. So metals, antimony is metals, arsenic is metals, barium is metal, cadmium is metal. So all these come under the category of irritant. The third one is neurotoxin. Neurotoxins, they are cerebral, spinal, peripheral neurotoxin are excitatory, psychotropics or somniferous, etc. Neurotoxins are those toxins which may directly affect your nervous systems, like your cerebral area, your spinals, and maybe peripheral neurotoxins. It may be excitatory, psychotropics and somniferous, many and more. So if you remember, we have discussed about the ADR, adverse drug reaction of aminoglycoside. That if aminoglycoside is being taken in a small and a large quantity, so what will be the ultimate adverse drug reactions? So that may be in the form of neurotoxicity and ototoxicity. So cardiovascular, this is another issue. So cardiovasculars, it means anticoagulants, dicumirols, warfarines, heparines, penendiones, etc. So all these are the classical example of anticoagulants. Antihypertensive, that is ramipril, verapamil, nifedipine, captopril, atenolol. So I mean that whenever we are using certain medications and a proper dose, and our main objective is to achieve the therapeutic effect. So those drugs which are used for cardiovascular disorder, so it is very important to maintain the concentration of the drug in the blood plasma. So as I have mentioned about the different anticoagulants like dicumirols, warfarin, heparines and penendione, all these are anticoagulants which prevent your blood from clottings. Definitely if they are taken in a huge and a large concentration, so it becomes toxic and it will produce toxicity. And miscellaneous agents like analgesic, non-steroidal, anti-inflammatory drugs, antipyretics, antihistamine, hypoglycemic agents and food poisonings. Okay, what is poisoning? Poisoning, it is the phenomena that occurs by the ingestion of any poisonous substance or coming in contact of any poisonous substance. That is called poisonings. Whenever something come in contact with your oral cavity and then those substances can be ingested. Poisonous substances can be ingested definitely, so it will cause the death of the individual. Types of poisoning, it based on the different type of effects. It may be acute poisonings, maybe chronic poisoning, it may be subacute poisoning, or it may be fulminants. So it depends or based on the effects. So that may be an acute poisonings, it may be in the form of acute poisoning, it may be in the form of chronic poisoning, it may be in the form of subacute poisoning, or it may be in the form of fulminants. In acute poisoning, it is the poisoning which is produced by a single large dose and more than one small dosage taken in a short period. The sign symptom is not fully clear, but headache, nausea, sweating, irritation, swelling, seizure, dizziness, increased heartbeat, pain, instigate other medication problems such as asthma occurs. Acute poisoning, this condition always occur when the poisoning is produced by a single large dose, or it is more than one smaller dosage which is taken in a short period of time. While in chronic poisonings, it is the poisoning which is produced by a small dosage taken over a long period of time. Its onset is slow, but it is very harmful condition. The typical signs symptoms which are reported, so it may develop over time due to poison, include such as cancer, damage of kidneys, damage of your brain, arsenic poisoning, and damage of other organs. And subacute poisoning, these types of poisoning lie between the acute and chronic poisoning, subacute poisoning, and carbon monoxide poisonings and organophosphate poisoning, etc. Fulminants, it is the poisoning which is produced by the massive dose of the poison. Definitely anything which is taken in a large concentration, so it become poison. But whenever, let's suppose, if the poison it is taken, or it is the poison which is produced by a massive dose of, if poison is said to be taken in a large concentration, so it become what? Fulminant. So death occurs very rapidly and sometime without any sign and symptoms, so it will cause death of the individual. It also depend upon, poisoning also depend upon, based on the wear process. Poison also may clarify into three types. One is suicidal, the second one is accidental, and the third one is abuse. Suicidal poisoning is the poisoning created by oneself, intentional and suicidal. Most of the poisonings are suicidals. Accidental poisoning, it is occurred by the administration of the poisons unintentionally, as accidental. So I mean that in suicidal poisonings, you are by self involved in such kinds of activity. When someone is trying to do suicide, so here the self intentional involvement, it may lead to death. While in accidental, sometime it is occurred in case of administration of the poisons which is unintentionally, as accidental. Abuse means poisoning occurs as a result of overdose of a substance that is used by a person for psychological and physical calmness. For example, morphine and nicotine. So in simple words, abuse means you can say wrong use of drug. So if the poisons or poisoning occurs ultimately as a result of overdose of any substance, for what purpose? In order for the purpose of psychological and physical satisfactions. For example, someone is using morphine or someone is using nicotines. So both are narcotic analgesics, and both morphine and nicotine can relieve the pain sensation as well as to cause sleep. Inshallah, in my next lecture we will discuss about the antidote. That what are antidote and different factors that affect the poisoning. So once again, thank you so much for watching my lectures. So if you didn't subscribe my channel, so please subscribe it, and also press the bell icon for my upcoming lectures. So if you need any kind of help, or if you need these contents, so you can you can directly email me, or you can directly contact me through my WhatsApp. So I am always available for any kind of help. Wish you all the best, and once again thank you so much for watching my lectures.